now in conversation with Matt Vogel, who's joined me from Denver in Colorado. He's the Executive Director of the National Mental Health Innovation Center. And I've invited him to join us for a panel session on both on Thursday and Friday this week to talk about some of the fallout issues of COVID-19 on physical and mental health. So, Matt, just tell me a little bit about your background.
Yeah, so I've been working in academic medicine in public health related, public mental health for about 25 years. And a lot of that was spent overseeing kind of the delivery side of things. And, I ran an outpatient practice helping people with mood disorders like bipolar disorder and depression for about 8 years, and just became frustrated with the inability of the mental health system to be able to treat all of the patients who needed care. We had long wait lists. We had a situation where we had wonderful providers at our center, but we didn't take most insurance, and so we were cash only, which put the care out of reach for most people. And I just became really frustrated at seeing patients get turned away from the system, and thought we have to do a better job in mental health of catching up to the rest of medicine by embracing things like prevention or the use of new technologies to bring us up to par with the rest of what was happening in medicine.
Okay, so how long has the National Mental Health Organization been in existence, the Innovation Center?
I founded the center 5 years ago.
Okay, and was that because of what you saw some of the developments in technologies to support mental health issues?
Yeah, we saw something really exciting and really troubling happening right at the same time. What was exciting is that we saw a lot of tech companies starting to say, oh yeah, we have discovered mental health, and we think that there's opportunities to build apps or software or devices to help improve people's mental well-being. At the same time, realized that it was kind of the Wild West, that we had a lot of these companies, a lot of startups that had no background in doing mental health, in many cases no background in healthcare, just coming up with apps and saying, we'll figure it out as we go. And they weren't engaging content experts, that weren't engaging universities and people to help them do some of the clinical validation studies and things to ensure that these products really were doing what they claimed that they were going to be doing. And we talked to the CEOs and said, well, why aren't you working with, with experts and working with universities? And they said, well, your answer for everything is, let's do a 5-year randomized trial. And that's not always feasible for us when we have to go back to our venture capitalists and our investors and say, hey, we need another 5 years. It just doesn't work. So we made a decision as a center, rather than asking industry to slow down, how about we speed up and let's go at their pace so that we can make working with us work for them, and to be able to help them develop these products in real world settings on faster timelines.
Okay, so you do some validation of the applications that I put forward to you. Is that how it works?
That's correct. We help with everything from helping companies build business models to helping them design and develop new products. And so we have a team of psychologists that we can tap into to help them create new content. We can do everything from beta testing of new devices to the validation trials, even helping people with the FDA approval process.
Okay, yes. I've noticed from this side of the Atlantic that the FDA are giving more and more approval to software and wearable devices for medical applications, which have been previously quite unprecedented.
That's absolutely correct. I think right now, in areas where there's not concern for patient safety, they have said we're willing to relax some of the restrictions and remove some of the safeguards just to help us get things in the hands of people that will benefit from them more quickly. Again, not at the expense of safety, obviously, but to help accelerate what has been at times a frustratingly slow approval process.
So are you aware of the organization in the UK called Orca?
I am not.
Okay, well, I think you should meet Liz Ashall-Smith, Liz Ashall-Payne, who is the CEO and founder of an organization called Orca, and they are the body that is responsible in the UK for validating mobile health applications. And so they do something, it sounds pretty much like you're doing. She was one of our panelists at our last webinar and virtual conference, and I'm sure that you have a great exchange of ideas. She's going to be around, I think, on Friday afternoon, and hopefully on Thursday as well to join in with the webinar, although she's not a panelist. So it would be good, I think, for you guys to make contact.
Looking forward to that. Yeah, always
Yeah.
good to have friends across the pond who are like-minded.
Yeah. So we've just noticed in the UK that there seems to be an increasing recognition that there's going to be quite a lot of mental health fallout from not just mental health, but other health fallout from COVID-19 that's not actually related to the virus, but is more related to self-isolation and some of the lockdown procedures. Is this what you will be observing in the States as well?
Yes, very much so. I don't think it's overstating at all to say that we are standing at the beginning of what will probably be the largest mental health crisis that any of us will see in our lifetimes. I think that the effects in the forms of PTSD, of increased rates of anxiety and depression, and unfortunately, very likely elevated suicide rates, are things that we're going to be seeing for a very, very long time. Long after we've found a vaccine and have moved on from the dealing with the virus itself, we're going to be dealing with the challenging psychological effects. I mean, just the economic impact alone, we know has very, very strong ties to depression and to anxiety and to suicide. So even without the virus itself, or just the economic impact, is going to bring about just a whole host of mental health challenges.
Yeah, I'm sure there's going to be a lot of discussion about that. And it was noticeable that I think it was this morning on the BBC news, there was a report that in the UK, we have had 8,500 more deaths in a day than we would normally expect at this time of year. And that of those 8,500 extra deaths, only 6,500 were due to coronavirus.
Yeah.
So it's clear that there are other things going on, and I think it's very much related to what we've just been talking about. And I agree with you that the backlash and the fallout from this is going to go on a long time after we found either a vaccine or some kind of testing which shows that whether people have got antibodies or not that will allow them to be protected.
Correct,
Well,
yeah.
I do appreciate you joining me at short notice. I'm sorry.
Oh, it's my pleasure.
It's been really nice to talk to you. I look forward to talking to you on Friday. You will
Likewise.
get an invitation, if you've not had one already, for being a speaker or a panelist at this event. I don't have time, unfortunately, at the moment to be able to show you the platform that we will be using on Friday. We're using Zoom on Thursday, primarily because it's accessible more widely than other platforms. But on Friday, we'll be using a platform called Remo, which, as well as having the same kind of tools as you've got in Zoom, they have some very good networking capability.
Networking, yeah.
Yeah. So I think that's going to be very useful for you to make contacts with people in the UK and in Europe, as well as other people within the States. But in the meantime, thank you very much for your time this morning. And I think we did a good job. We finished on time, and I look forward to seeing you on Friday.
Sounds great. Thank you so much. I really enjoyed it.
Okay. Thanks, Matt. Bye-bye.